Hi everyone, Gustavo Gasparin here. We are back at Dynamics MMA with Dr. Mike Pajakarski. Today is our last video of this series. We're gonna talk about the heel hook, inside heel hook and outside heel hook, okay? How does the heel hook affect my knee?
Okay, so I'm gonna demonstrate how this submission works. So first there's the standard heel hook where I'm isolating the femur. I'm going to internally rotate the tibia like this. There's also the other variation, which is the inside or reverse heel hook, where I'm going to, again, isolate the femur and rotate the tibia externally. I'm going to break apart how the knee works. So the knee or the tibiofemoral joint has 2 degrees of motion, so it can straighten and bend, and it can rotate at the tibia. The heel hook submission works by rotating the tibia, whether it's internal or external, depending on which heel hook you use. So what I want to do when I lock it up, I have to make sure that I isolate this femur, so the only motion that it comes is the tibia rotating in, right here. There are 3 ligaments in the knee that will stop this rotation. You have your ACL, your MCL, and your LCL. All of these are structures that try to prevent this excessive tibial rotation. If the submission applies an excessive amount of force, those are ligaments that can be affected. However, when I do a standard heel hook, I'm also rotating the ankle in like this. If you remember from our second video where we described how the toe hold works, it attacks those ligaments as well. So the heel hook works on both the ankle and the knee.
So that's the outside heel hook also working on my ankle joint.
Correct. So when I demonstrate again, when I go for the submission, I have to isolate the femur and I internally rotate the tibia. When I turn, this may be the limiting factor that will be affected first before I attack the ligaments in the knee.
Realize how vulnerable his back was. Oh, back on the outside.
Back
heel
in
hook.
his world,
Ooh.
cranking that.
So what's the difference between the outside heel hook and the inside heel hook?
So like I said, with the standard heel hook, when I do this motion here, I'm affecting ligaments on the outside of the ankle. This motion, there's a ligament here called the deltoid ligament, which is very thick, and it's going to take a lot of force, more force than people can generate to rupture this. So when I go for the reverse or the inside heel hook, when I do this external tibial rotation, there's no force going to the ankle. It's going straight for the knee. So most of the force is going to be attacking the knee and the ligaments that are preventing this motion. That's why the inside heel hook is more likely to cause ligament damage than the outside one.
And you know, Gary's not one to play with on the floor, but Fogelman's doing it. There it is. It is done.
All right. So the outside heel hook is being protected by my ankle a little bit. It can transfer force to my ankle, while the inside heel hook, it's all on my knee, all on my ligaments.
Correct.
Right. And another question: why the heel hook is so dangerous compared to straight leg locks like knee bars and straight ankle locks? What's the biggest difference that can cause damage on my joint?
Well, so there's 2 reasons. The first, you take a straight submission, whether it's going to be the straight ankle lock or the knee bar. Both of those have muscles that oppose this motion, whether it's your tibialis anterior or your hamstring. So in both of those submissions, you're getting a stretch, pain before damage occurs. For the heel hook, there's no muscle that opposes this, so the only structure that's being resisted are these ligaments, which don't have the same sense receptors in the body. So by the time that the submission is applied, there's a small window before damage occurs. The second reason why it's more dangerous is because the heel hook attacks the ACL. It's a ligament that does not repair itself. So some of the other structures will heal on their own. The ACL does not, and it's often requires a reconstructive surgery that can take 6 to 12 months of rehab. So a lot of people find that more dangerous because when something bad happens, not only was there a smaller window, but now they're out of training for potentially up to a year.
So in the heel hook, I might not feel enough pain, right? I might have to tap before I even feel pain. That's correct?
Correct.
So that's a nice safety tip for you guys. Don't wait until you completely feel that you're getting hurt, because it might be too late. Correct? Might
Correct.
be already tearing.
Correct.
Correct. All right, thank you very much. Thanks for watching, guys. This is our last video of this series. Hope you guys have liked, and talk to you guys soon.